Welcome everybody to today's webinar. This is being presented by myself, Simon Murphy, and by Dr. Nick Page. And we're going to be talking about young people's health and wellbeing in Wales and providing some key findings from a national report that was published a few weeks ago. This draws on the data from the Schools Health Research Network with a focus on the pupil survey that we conducted in 2019-20. To begin by saying a little bit about the survey itself, the Student Health and Wellbeing Survey is conducted every other year across the whole of Wales. It's administered to all secondary school pupils from age 11 to 16 years old. And it's conducted in theory, every secondary school in Wales that are part of the School Health Research Network. The measures themselves were developed from the WHO's Health Behaviour in School Children Survey, which is a cross-European survey conducted in schools, so it does allow us to have international comparisons when that is done. Alongside the pupil survey, we also collect data from senior leadership teams about the school environment, focusing on the types of policies and practices that schools have in place. So what do we aim to do with that data? Well, it allows us to monitor adolescent health behaviours in Wales to increase our understanding and inform policy. And I'll say a little bit more about that in the next slide. It's important to understand the value and uniqueness of this data. In 2019, we were able to collect data from 198 schools, and that's 94% for all the eligible secondary schools across Wales. And nearly 120,000 students completed the survey as well. And that represents 72% of all the potential students across Wales. So the value of this data, is extremely high. It provides not only a national representative sample for Wales, but it allows us to look at particular groups that might face particular health issues, so small subgroup analysis as well. So if we just move on to understand the different ways that we are using the data, you can think about data use at multiple levels. Now, for those schools that are attending this webinar, they'll know that we provide each of the schools that participate with their own tailored report, and that's benchmarked against the national averages, so they can see where their school is doing well and where there might be areas for improvement. And we also provide the regions with their data as well, benchmarked against the national picture, so that, again, they can get an understanding of where they sit and where the areas they might want to focus on. This can in turn inform schools as learning organisations and strategies supported by Welsh Government, professional learning strategies, and also can be useful data for ESTIN, for accountability and frameworks. By putting the pupil data together with the data from the senior leadership teams, we're able to look at the relationship between what goes on at the school level and pupil outcomes. And that can be very useful for example, Public Health Wales, the Healthy Schools scheme. As researchers, it provides us with really good data for baselines and follow-ups and understanding what's going on in schools when we're conducting research studies, and it reduces the research burden on schools because we can use that across multiple projects rather than collecting it for each project in turn. But the two areas that we're really going to focus on today is its use in population data trends, so understanding what's going on in Wales across years and the opportunity also for international comparisons. It's worth saying that data is used by Welsh Government for policy monitoring and evaluation, and this is going to be particularly important now going forward for developing COVID-19 recovery strategies, but also a whole range of key policies that are coming out and being implemented at the moment around whole school mental health, the new curriculum, future generations, social isolation and loneliness strategies, violence in women. So I hope that has presented some kind of context for people about the usefulness of this data. And I'm going to hand over to Nick now to present some of the key findings from the report.
Brilliant, thanks Simon. So in the 2019 report, we had 6 main findings chapters. And just to give you a flavour today, what we've done is we've just pulled out sort of 4 sort of key variables from each chapter. And we're having a look in terms of gender differences, a little bit of differences by age, and in terms of the affluence of the students. So the first chapter is mental health and wellbeing. And our 4 measures, we're looking at life satisfaction, we're looking at loneliness during the last summer holidays, and we're looking at sort of indicators of mental health symptoms. And those 2 measures are based off the Strength and Difficulties questionnaire, which was first introduced in the survey this time around in 2019. So in terms of life satisfaction, this is based on the Cantrell ladder. So young people are asked to rate their life satisfaction between 0 and 10. So 0 being the worst possible life and 1 being the best possible life. And what we're looking at in the first column is just the percentage of the students who rated their life satisfaction as 6 or above. So we have, just to go through very quickly, we obviously have a higher percentage of boys than girls that rated their life satisfaction as higher. In general, this is actually a decrease from the 2017 survey. Just to be clear, we haven't actually run some significance testing for change over time here, but so any change I'm speaking about is just in terms of a percentage point change from the 2017 survey. So we have decreases really across the board in our categories for life satisfaction, with about a 5% percentage point drop among girls being the highest decrease. Year 7s report a higher life satisfaction than Year 11, and those of higher affluence reported a higher life satisfaction than those of lower affluence. In terms of summer holiday loneliness, just to state that actually we flipped this compared to the last report. So in the last report, it was the percentage that were never or rarely lonely, where this time after feedback, it's the percentage who did feel lonely during the last summer holiday. Generally speaking, this hasn't really changed much since the last survey, staying at around about 31% of young people who felt lonely. You can see there's obviously a gender difference there with girls more likely to report loneliness than boys. The neither describes me, that's actually a new category that was introduced in the 2019 survey, so we can't compare back to changes from 2017. But this is obviously those young people who thought that neither a male or female gender best described them. You will note during a lot of the variables presented that they might actually have worse outcomes on some of these measures, but just to state that actually, as a proportion of the whole sample, this particular group is around about just over 1% of the entire sample. So loneliness during the last summer holidays was relatively similar to the 2017 survey. In terms of the SDQ measures, the Strength and Difficulties questionnaire, this is a 25-item scale that asks young people really how true certain statements are. So things like, for example, whether they worry a lot or whether they get angry and often lose their temper. There's an overall scale score based on all 25 items, and there's also subscales, and one of the subscales is emotional problems, and that's the second item that we're looking at here. So we wanted to see the percentage of young people who were scoring very highly in the overall scale, and also those who are scoring very highly for emotional problems. And as I said, this is the first time that we've had the SDQ in the survey, so there's no comparison with the 2017 survey this time. So generally speaking, we had obviously overall, we had about 19% of young people scored highly in the overall SDQ, or very high, sorry. Girls were more likely than boys, so you had 21% of girls scoring very highly compared to 15% of boys, but a much larger proportion of those who suggest that neither word describes them. Year 11s were more likely to have very high mental health symptoms compared to Year 7s, and those of lower affluence were more likely to have very high mental health symptoms than those of higher affluence. And we see similar trends again with the emotional problem scale, where we have girls more likely than boys, for example, to score very highly, but again, not as high as those where neither word describes me. And then we have similar breakdowns by age and socioeconomic status. Okay, so school life. So again, 4 measures picked out. So the percentage who like school a lot, the percentage who agree there is a member of staff they can confide in, the percentage who agree their ideas are taken seriously within school, and the percentage who agree that there is support for students within school who feel unhappy, worried, or unable to cope. Again, these measures were included in the 2017 survey, so we have a rough indication of change over time in these measures. There was no change in the percentage who liked school a lot. Overall, a slight reduction in girls compared to the last survey, and a slight reduction in the proportion of your year 7s who liked school a lot compared to the last survey. But generally, the percentages were relatively consistent, and we have that boys and girls around 18 and 17% suggest they like school a lot. In terms of a member of staff that they can confide in, we have a slight increase from the last survey of about 2% overall. Generally speaking, boys and girls had similar increases, and that was consistent across the board in terms of age and socioeconomic status, with a slight increase. We had year 7s had a higher proportion, suggesting they had a member of staff to confide in compared to year 11s, and those of higher affluence, there was a higher proportion than those of lower affluence. In terms of who agree that their ideas are taken seriously, there was no change overall from the previous survey, and not much change in any of the subgroups as well. So those proportions are relatively consistent from the last survey, and we had around about 39% of boys agreed that their ideas were taken seriously, compared to around 36% of girls. And again, we have similar sort of age and SES differences as we've seen in some of the other measures, where we had a higher proportion of year 7s thought their ideas were taken seriously compared to year 11s, and a slightly higher proportion of those of higher affluence compared to those of lower affluence. And in terms of the last measure, so we're looking at support for students who feel unhappy, worried, or unable to cope within schools. We've actually, on this one, we've had a decrease since the 2017 survey of roughly about 6 percentage points overall. There was sort of most movement in this measure compared to the other school life measures that we're reporting on today, with drops of about 4 and 8 percentage points among boys and girls, and up to a 10 percentage point drop among year 11s. We've still got, so 69% of boys, 65% of girls reported that there was support, 54% of year 11s, and that's a drop from 64% in the 2017 survey. And again, drops in both affluence categories as well, of 7 percentage points and 5 percentage points from the previous survey. Okay, the third findings chapter focused on physical activity and diet. The 4 measures that we're looking at is the percentage who are physically active for at least 60 minutes per day, so that is the recommended guidelines. The percentage who walk or cycle to school, the percentage who eat breakfast every weekday, and the percentage who drink energy drinks at least daily. So we have, in terms of physical activity, we had a very minor drop from the 2017 survey. Obviously, the gender gap between boys and girls remained, with a higher proportion of boys meeting the physical activity guidelines compared to girls, 21% compared to 13%. In terms of age, we had a higher proportion of year 7s compared to year 11s who meet the daily physical activity guidelines. And we have a higher proportion of those from higher affluent families who are more likely to meet the guidelines. And again, generally speaking, we've had sort of minor percentage point changes, declines from the 2017 survey. The most was among year 7s with a 3 percentage point drop from the previous survey. So in terms of active travel, so the percentage you walk or cycle to school, this has increased marginally from the previous survey. Generally speaking, that was consistent across most of the categories. So we have a slightly higher proportion of boys compared to girls, 37% compared to 33%, who walked or cycled to school. That was both up 1 percentage point from the previous survey. And we had 35% of those where neither word described them. In terms of age differences, again, year 11s, that was consistent from the previous survey, and a slight increase in year 7s. Those of low affluence, there was no change from the previous survey, with 42% walking or cycling to school, and a slight 1 percentage point change in terms of those who were of higher affluence. In terms of weekday breakfast consumption, we had an overall 2 percentage point decrease from the 2017 survey, and most of those decreases were evident across most of the subgroups. So we already have a higher proportion of boys than girls who do eat breakfast every weekday, and a much lower proportion of those that neither word describes me, at 35%. In terms of the change from 2017, you get a 3 percentage point drop among both boys and girls, also a 3 percentage point drop among year 7s, and a 4 and 3 percentage point drop respectively among those of low and high affluence. So it does suggest among most subgroups there's been a decrease from the previous survey in the percentage who eat breakfast on weekdays. In terms of our last measure, we looked at the percentage who drink energy drinks at least daily. Again, we've actually had a decline in this from the previous survey. That was evident in all of the categories. So we have 5% of boys and 3% of girls who drink energy drinks at least weekly. That's down from 7% and 4% in the 2017 survey. In terms of, there was drops obviously by age as well. And in terms of those of lower or higher affluence, we had drops from 8 and 5% in 2017 to now 6 and 4% in 2019. Obviously, as you can see, there's a much higher proportion of those who self-identify as neither a boy or a girl, 18% who reported drinking energy drinks at least daily, but obviously we have no comparator from the 2017 survey. Okay, moving on to family and social life. So our 4 measures here, we looked at the percentage who are classified as a problematic user of social media, the percentage who last viewed an electronic screen after 11 p.m. on a school night, and the percentage who have been cyberbullied in the past couple of months, as well as the percentage who agree that they get the help and emotional support that they need from their family. So social media is based on the social media disorder scale. The cutoff for problematic social media use is those scoring 6 or above on this scale. That has actually changed from the previous survey. So the reported figures in the last report are not directly comparable with those reported here. However, in the 2019 report, we have supplied in the appendix what the correct comparator would be for the 2017 survey. So you can make comparisons, and I'll make a couple of comparisons here. So overall, there's been a drop in the percentage of young people who are classified as problematic users of social media, from 12% in 2017 to 10% in 2019. In terms of the gender difference, you can see it's a higher proportion than girls than boys who would be classified as a problematic user of social media, but the higher proportion is among those self-identifying as neither a boy or a girl. In terms of age variations, we have slight drops from the previous survey, and in terms of low and high affluence, we have slight drops from the previous survey as well. As probably possibly would be expected, you had a higher proportion of year 7 compared to year 11 who were defined as problematic users of social media. To a similar topic with screen use, we had a slight increase in the percentage who last viewed an electronic screen after 11 p.m. on a school night from the previous survey. The percentage of boys remained the same, but the percentage of girls reporting this went up by 2 percentage points. You can see from the neither describes me category, that was those young people reported the highest percentage of screen viewing after 11 p.m. on a school night. Year 11s, again, much more likely than year 7s to report screen use after 11 p.m. on a school night. And those of lower affluence, more likely than those of higher affluence to report the same behaviour. And again, these were slight increases on the previous survey. The next variable is the percentage who have been cyberbullied in the past couple of months. This had a slight 1 percentage point drop overall compared to the previous survey, but only some of the subcategories were there actual changes. So for boys, 15% reported that they had been cyberbullied. That is the same as the previous survey. The 21% of girls reported that they had been cyberbullied. That's a slight drop from the previous survey. Again, closer to 2 in 5 young people of those identifying as neither a boy nor a girl reported having experienced cyberbullying in the past couple of months. There was not much variation in age. You can see that 17% of year 7s compared to 18% of year 11s, and only slight variation in affluence. So 20% of low affluent young people compared to 17% of high affluent. And again, most of these were just very slight declines of a percentage point or 2 percentage points from the previous survey. In terms of our final measure in this section, so in terms of those who get help and emotional support from their family, who agree that they do, we had a very slight 1 percentage point increase from the previous survey. And again, some of those were borne out in various subgroups. So for example, we have 71% of boys, that is a slight increase from the previous survey, and 70% of girls, which is a 2 percentage point increase from the previous survey. No change among year 11s, where 76% agreed they get the help and support from their family, and 64% of year 11s is a slight increase from the previous survey. Those of higher affluence compared to those of lower affluence, there was a higher proportion who thought they got the help, agreed that they got the help and emotional support that they needed from their family. So 73% compared to 63%. Okay, so this is just looking at relationships. Here, the 4 measures that we'll be looking at is the percentage of young people who have ever sent a sexually explicit image of themselves, so sometimes referred to as sexting. And then the percentage who have ever had sex, and that was asked to year 11 students only. The percentage who had their first sexual intercourse before age 14, again, only asked to year 11s. And the percentage who used a condom during their last sexual intercourse, again, asked to year 11s only. So in terms of sexting, from the last survey, there's a slight 1 percentage point drop, with about 10% of young people reporting that they had sent a sexually explicit image of themselves in 2019. As you can see, both boys and girls, that was very similar, with 9% of boys and 10% of girls, but a higher proportion of those just self-identifying as neither a boy nor a girl. In terms of age variation, there was no change among year 7s, where there was 2% who have sexted, and a slight drop compared to the previous survey of year 11s, where 23% reported having sent a sexually explicit image. In terms of differences by affluence, there were none here, both 10%, and both of those were a slight decline from the previous survey. Okay, so in terms of year 11s who reported ever having sex, there was no change from the previous survey, with both boys and girls, 25% of year 11s suggested that they had sex, although this was higher among those self-identifying as neither a boy nor a girl, at 53%. Obviously, this is only asked to year 11, so there is no variation to look at by age, and there's no variation either in terms of affluence, with 26% of lower affluent young people compared to 26% of those from higher affluent families. In terms of the age of first sexual intercourse, so those who had their first sexual intercourse before age 14, we have no change from the previous survey. Overall, it's around about 20%. You can see the difference, though, between boys and girls has remained, with 24% of boys reporting a sort of a younger age of first sexual intercourse compared to 15% of girls. That is a 1 percentage point decline among girls, but nothing else in that category has changed. In terms of our final measure in this section, which is the percentage who've used a condom during their last sexual intercourse, you've had a 1 percentage point change from the previous survey. So from 46% who had in 2017 to 45% who reported using a condom in 2019. Still a disparity between boys and girls in this measure. So we had 48% of boys compared to 43% of girls. That's no change among boys from the last survey, but it is a 3 percentage point decline among girls for 2019. In terms of differences in terms of affluence, we actually have a drop among those of lower affluence compared to 2017. So here we have 38%. That was 43% in 2017, so a 5 percentage point drop from the last survey. And in terms of those of higher affluence, it's 48%, but that's only a 1 percentage point change from the previous survey. Okay, so this is our final section here. This is on substance use. Our 4 measures are the percentage who currently smoke tobacco at least weekly, the percentage who use e-cigarettes at least weekly, the percentage who drink anything alcoholic at least weekly, and the percentage who have ever used drugs. And the drugs included in that measure are noted at the bottom of the slide. So for each of these measures, there was no change overall from the previous survey in 2017. So for smoking, that remained at 4%. For e-cigarettes, that remained at 3%. For weekly alcohol use, that remained at 8%. And for having ever used drugs, that stayed at 15%. For smoking, there was no change in any of the subgroups. For those for e-cigarette use, there was some drops, a slight percentage point drop among boys, among year 11s, and both among those of low and high affluence. For alcohol, there was a slight drop among girls compared to the previous survey, a slight increase among year 11s compared to the previous survey, but no change in the other categories. And finally, having percentage of those who've ever used drugs, we have 60% of boys compared to 13% of girls. That's a 1 percentage point increase for boys and a 1 percentage point decrease for girls. And again, for the other categories, we have a slight 1 percentage point decline for year 7s and 11s, and a 1 percentage point increase for those of higher affluence. But otherwise, little variation in affluence for having ever used drugs, but obviously a higher proportion of year 11s compared to year 7s. Right, so that is a real whistle-stop tour of the national report. Obviously, there were many more measures within each section that we couldn't report on. We've obviously kept it to 4 measures per section for the webinar, but please do have a look at the report. And as I said, the link is in the last slide at the end of this presentation. So just very, very quickly, because there was so much there, to put out just one sort of key finding, I suppose, from each section. And so in terms of mental health and well-being, we found that 1 in 5 young people reported very high levels of mental health symptoms. This is the very high category. If we were looking at those who reported at least slightly raised symptoms, you're looking at more like 2 in 5. In terms of support in schools for students who feel unhappy, worried, or unable to cope, so sort of mental health support in schools, we found that around 7 in 10 agreed there is support at their school. However, this is a decline from the previous survey, where it's still around 7 in 10, but we had 67% in 2019 compared to 73% in 2017. In terms of the physical activity and diet chapter, we found that almost 1 in 5 young people met the recommended physical activity guidelines, so 60 minutes of physical activity per day. We had, for family and social life, we had 1 in 10 young people were classified as a problematic user of social media. For the relationships chapter, we've had 1 in 10 young people have sent a sexually explicit image of themselves. And finally, in the substance use, we had that less than 1 in 5 have ever used drugs, although that's no change from the previous survey. Okay, so just to highlight, obviously, so this was the findings from our 2019 survey. So where data was collected between September and December 2019. So just prior to the global pandemic. Our next survey is due in the end of this year, 2021, with data collection due to commence in the autumn, hopefully around the same time again. The main change from the 2019 survey is that now in 21, we will incorporate the International HBSC questionnaire, which we do every 4 years. So we did in 2017 and will again now in 21. The benefit really of this is that it enables cross-national comparisons with all participating countries within the HBSC study, currently around 50 countries. And obviously, because of the data collection period for 2019 being just prior to COVID-19, really the importance of both surveys can't really be overstated. This survey is really captured in really important baseline data and trends before COVID. We really started experiencing the fallout from COVID. And obviously our 2021 survey will provide invaluable opportunities to explore young people's behaviours in the context of COVID. And so we're obviously hoping to begin recruitment relatively shortly. And yeah, we can't sort of promote the benefits of the 2021 survey enough. And we're hoping obviously many schools will participate with data collection this year. That's the end from me. I don't know if Simon, you have anything you'd like to add?
No, thanks, Nick. I just point people to the report itself because, as Nick said, there's a lot of data there, and we've only probably just skimmed the surface and identified some sort of key points for the discussion. So, thanks very much.
Brilliant. Thank you.